going to be reviewing several case studies as far as procedures and treatments. So we're going to look, evaluate, assess, and then come up with the treatment protocol plan by all the pearls of the experts that we have here today. These are some of the models and pictures, and what I would like to do is have our panelists here. Dr. Shino will talk about his patient here, and we will ask questions as to how everyone's approach may differ, because you may have several different approaches in the world of aesthetics. Not everything is going to be identical. It's just not cookie cutter. It's a matter of expertise, skills, and clinical experience, which is what makes one person more cutting edge than the other. And this is what we try to share with all the students at Empire Medical Training in order to be able to enhance their skills, teach them about safety, anatomy, and what the best way it is to be able to deliver to your patient in the consultation process as well as results. So Dr. Shino Bay.
This is a patient of mine, 45-year-old female. I'm very interested to see some of the members of the panel to tell me how would you approach the before photo, and then we'll tell them what exactly I did to achieve this look on her. Great.
First thing I would do is medical skincare. I think her skin is rather heterogeneous. I'd like to actually create more uniformity. I get her on a medical skincare regimen. I would do chemical peels, and then after that, I would actually look at incorporating the toxins. Basically in the upper third of the face, around the eyes, and then I would look as well too at replacing lost volume in the mid-face, and also too around her mouth, most specifically in the marionette lines. But I think the big area for me would be probably the mid-face, because that really to me anchors the look of the whole face and gives it proportion, symmetry, and balance.
Perfect, Dr. Time.
It's really interesting, and kind of knowing your background, I suspect that maybe some sculpture is maybe involved, because you mentioned the skin care, because the skin obviously looks better, but probably some resurfacing, maybe a photofacial. Going back to the volume replacement, it's interesting. I don't know if it's the lighting, but her forehead looks improved, so I suspect maybe some forehead fillers, which I know you're really big into. Toxins, of course, around the eyes. Medial cheek, I think, is important here, because it's going to elevate her nasolabial fold and improve the overall lower third of the face. But nice job, very subtle improvement, very impactful.
Dr. Castillo?
So I'd have to agree with most of what the other panelists have said, but it looks like her face is a little bit more rested and a little bit lifted. So I would suspect that you may have used some sort of neuromodulator for the upper third and even the lower third periorally. And looks like her lips have been kind of redefined a little bit. The corners of the mouth have been lifted. So maybe perhaps some fillers around there. And I think the rest of the face, I'll guess that you've kind of volumized it with Sculptura, because if I'm seeing correctly, her temples look rejuvenated too. So I think the overall it's more of a high V oval shaped face. So it's been lifted. Now, whether in Sculpture or not, it looks good and her skin looks better.
So I'm going to tell you exactly what I did, and I agree with all of that. We definitely put her on a skin regimen program with one of our estheticians. I think she was using like Clear Brilliant, Hydro Brilliance to improve the quality of the skin. My part was I actually ended up using Radius, and I did my HD Sculpt technique, which is using a high G prime product in order to recontour the face. As you could see on the before photo, she looks a little bit heavy on the cheeks. Things are coming down due to volume loss on the mid-face. But as you can see, that she has kind of like a square face. And we're trying to get this oval shape. So I did Radius, I did work on her temples, mid-face, and the jawline. And I did treat the masseters with neurotoxins, because she is a clencher, heavy clencher and grinder. So that's why the whole shape of the face changed. And then she had neurotoxins on the upper face, and I did mesotox, which is injecting very superficial on the skin to alleviate the tiny wrinkles around the eyes. So that was my technique with this patient.